And welcome back to the Insana Quotient. As you know, earlier this week, the House of Representatives has moved to repeal one element of the president's health care reform bill that would have required companies to issue 1099s to any firm to which they paid $600 or less for services as a very strange element of the health care reform bill. The president is also likely to sign off on repealing this rather onerous paperwork record. But when you look at broader health care reform issues, and there are still many things to be debated, there is a need still for greater progress to be made when it comes to the implementation of cost savings efforts when it comes to healthcare reform. And our next guest has a great deal of experience, both as a participant in the healthcare industry and also a two-time recipient of a liver transplant. He has been intimately involved as a healthcare consumer and as a purveyor of healthcare services. Jim Traficant has been working with Harris Corporation, where he developed a healthcare solutions division. He's also worked with the Department of Defense and the Department of Veterans Affairs in order to improve healthcare for veterans. And he joins us now to talk about some of the problems and maybe some of the solutions that could help make healthcare more affordable in this country. And Mr. Traficant, we appreciate you taking the time to join us. Thanks for being with us today.
Sure. Good morning, Ron.
Let me ask you about your experience as a patient before your experience as a provider of services and solutions. What did your experience tell you about our healthcare system today, given that you've gone through really quite a major experience twice so far in your life?
Yeah. The simple answer is that healthcare has lots of data. What's missing is information. And I learned this during my first transplant. My neighbor, retired Army Lieutenant Colonel Frank Finelli, risked his life for mine in a living donor liver transplant. In the course of our treatment, just great care. They said the surgery science, the medication is art. And what we learned afterwards, the reason it's art is that there's insufficient information to make decisions at the point of care.
Now, why is that? I mean, given that this is a particularly complex procedure, and what information gap is there after having gone through as risky a procedure as you went through? What didn't they know about your post-operative care?
I'll give you an example. When I was waiting for Frank to recover. I had a very quick recovery, but Frank was struggling. And while I was waiting for him to get well, I went into rejection, and they couldn't stop it. And so they said, we're going to give you a shot. We don't know if it'll cure you or kill you. We'll know in 20 minutes. When
Nice.
I went through this for a month, I was in the most expensive part of the hospital, life-threatening treatment. I got out. It happened again. I went back in a second time for a month. Well, after that, I began to correlate. I started to study my blood work and my medications, and then came up with a formula that you could predict when rejection would occur. We developed the symptoms a third time, showed the data to my doctors, and based on the information, we changed the medicine. And we were able to abate the rejection, the life-threatening treatment, and the expensive hospitalization. The answer was in the data, and that's true today, and that's what we're trying to do at Harris, is turn the data into information and make it available on demand inside of the healthcare system.
Now, how come the doctors weren't able to do this themselves?
Because there's too much information. The pressure on physicians today is extraordinary. They have very limited time to make decisions. And the information, they almost have to start from scratch. Most people walk into a hospital with a box under their arm of paper and CDs, hoping somebody could make sense out of it. And what we're doing is turning it into electronic information, making it secure, and delivering it from where the information was created to where it's needed so that we can get better care at lower cost and faster.
Now, as you say, though, we have a lot of data and not a lot of information. How are you turning that data into information that a doctor can use, as opposed to, a kind of reams of data that they still have to sift through and come to a conclusion?
We're taking the information where it's created. You go to your local doctor, and information is created. You end up going to the hospital and they have no access to that information. So if you want to transform healthcare, we have to come up with a connected framework for healthcare so that the information can flow securely and maintaining the privacy of the patient but delivering it where it's needed. So when you walk into an emergency room, they don't start from scratch trying to figure out what's wrong. That your information shows up when you do, and they have situational awareness and know how they can start to help, and they can do it much more efficiently.
You know, it's interesting that you say that. I after President Clinton had his heart attack, I had a conversation with him a couple weeks after he got out of the conversation. We sat down and did an interview, and he said when he went into the hospital, and this is a former president of the United States, they asked him which immunizations he had as a child. And he's like, I have no idea. I'm having a heart attack, and they're asking what my immunization history was. And we've been talking about this for quite a long time. We've seen technology do remarkable things from the likes of a Facebook to a Google. Why is it that the healthcare industry cannot adapt as quickly as the technology industry is?
I think healthcare is just lagging. And the good news is we've gone through these digital transformations in a host of other industries, like, as you mentioned, in banking, in the way that we interact every day socially. And we're bringing that same technology to healthcare. We've been able to connect the federal agencies like Military Health and Veterans Affairs, Indian Health Services, the largest creators of health information, so they could share with the consumers of health information at the federal level, like Social Security, CDC, the National Cancer Institute, and others. And then one of the things we learned in the process is over half of all care provided for active duty and retired service members comes out of the private sector. So up until now, it wasn't possible. If you went to your local doctor or hospital and you were in the DOD or the VA, your information was locked at the federal level, and there was no access in the private sector. And we're changing all of that by providing this connected framework for healthcare.
Yeah, I mean, it is amazing when you think that, you know, in the course of 6 years or so, Facebook was able to amass 600 million users who are quite willing to provide a great deal of detailed personal information and do so with hardly a bump in the process. And we have entire organizations that can't mirror that type of speed.
Yes, but up until now, the information has just been isolated in pockets. You have legacy systems.
Yeah.
Hospitals having to invest to provide this connectivity. And then if you look at the spend at the national level, you know, we were talking about all the budget challenges on Capitol Hill. One of the biggest drivers in spending is healthcare. We spend 4 times the amount of money on healthcare as we do for defense. And we're not getting the return on that investment.
Yeah. Yeah. So how would your connectivity system work? I mean, what happens in the transformational process to make this obviously a more vibrant, a more rich, and a more useful tool in healthcare? And subsequent to that, how much can we save in terms of cost?
Let me start with the question on savings. Yeah. O&B estimates we could save 1/3 of the federal spend on healthcare if we could get to a data-driven care delivery model where you went and based on your conditions and all the information available, we can then provide guidance about how to best treat you. 1/3 of the federal spend. And I'll give you an example that's in play today. When we provided this connectivity at the federal level for healthcare, Social Security testified to the Health and Human Services Secretary that on average, it would take them 83 days to find the health information required for them to do benefits determination. What were you entitled to as a Social Security benefit?
No.
When they went through the connected framework that Harris created for the federal health architecture, they went from 83 days to 24 seconds accessing that information. We think that's the kind of transformation that the nation is looking for.
Yeah, I would think. Very quickly before we let you go, with respect to the process itself, what is different about your connectivity than other technology solutions being proposed?
A couple things. One, that it's open, meaning we actually create the connected framework, and we're trying to create an economy, if you will, for healthcare because it's connected. So the software we created for the federal government is free, and we're having companies taking this connected framework and putting it with their products. We're seeing the federal agencies use it, being used extensively in the private sector. And once we get the connected framework, now we can start looking at things like fraud, waste, and abuse. We could look at things like how do we move the information where a patient needs it. So now it's better care, all the information secured, and it shows up when they do on the computer screen for a clinician, not in a box under the patient's arm.
All right, Mr. Traficant, we have to leave it there. We'd love to get you back and talk more about this in greater detail. Jim Traficant, who's a health information technology expert and who's been a patient under some rather critical situations.